Hi, I'm Dr. Tracey Banks, and welcome to Bankable Health Tips. This is a show where we provide you with the latest information on health topics that concern you. Today, we're going to continue our series on contraception and talk about emergency contraception, or contraception. So let's get started. So what is emergency contraception? This is birth control or contraception method that happens after a woman has had sex or her previous method has failed her, like the condom broke. There are two types of emergency contraception. One, emergency contraception pills, and the other is the copper IUD. Let's talk about the pills first. The first pill is the progesterone-only emergency contraception. This is usually pills that you take as single or two pills taken 12 to 24 hours apart, and it contains progesterone only. The way it works is that it prevents ovulation. So it prevents your ovaries from making an egg, and it is most effective if you take it within 72 hours or 3 days after unprotected sex. The advantages of this pill is that it doesn't affect a pregnancy if it's already in existence, and if you're over 17, it doesn't require a prescription. The next type of emergency contraception pill is the combination pill, in that it contains both estrogen and progesterone. And this usually is taken in 2 doses and also prevents ovulation like the progesterone-only pill. The advantage of this one is that it can be taken up to 120 hours or 5 days after unprotected intercourse, but it's not considered as effective as the progesterone-only pill. It also requires a prescription. The next type of emergency contraception pill is called ulipristal, or Ella in the United States. It can be taken up to 120 hours or 5 days after unprotected sex. An initial study showed that this may be the most effective type of emergency contraception. You will need a prescription for this, and you can only take it one time during a menstrual cycle. At this time, we don't know what effects it may have, though, on a pregnancy that's already established. The next type of emergency contraception is the copper IUD, or intrauterine device. This is a little T-shaped device that is inserted inside the uterus within 5 days after unprotected sex. It is 99% effective in preventing pregnancy and has the additional advantage of being long-term contraception because it's good for 10 years once it's inserted. Thank you for viewing our segment on emergency contraception. In our next segment, we're going to cover the intrauterine device, or IUD. Thank you for viewing Bankable Health Tips. I'm Dr. Tracey Banks. And remember, be healthy.